Generally, natural teeth may vary widely with its theoretical description. But to perform dental procedures in patient's mouth, we should be able to recognize the normal and abnormal morphology of individual tooth. Keeping that in mind, let's see about the morphology of permanent maxillary central incisors. Maxillary central incisors are two in number, which are adjacent to midline, share mesial contact with each other and distal contact with lateral incisors. We know well there are numbering systems used to identify different teeth. Starting from Palmer notation, which uses quadrant system, beginning with central incisors, the teeth are numbered 1 through 8. So both central incisors having same number as 1, but with symbol representing quadrant, underneath for right and this for left. As per universal system, the maxillary teeth are numbered 1 through 16, beginning with a right third molar. Thus, right central incisor is designated as 8 and a left central incisor as 9. Finishing with FDI's two-digit system, where first digit indicates a quadrant and second digit indicates the tooth within the quadrant. Beginning with central incisors numbered 1 through 8 in each quadrant. So notation 1 is for right central incisor and 2 is for left central incisor. Now, let's begin with brief morphology starting from labial aspect. The basic shape is trapezoidal with longer parallel end incisally and shorter cervically. From the labial view, the mesial outline of crown is slightly convex with its height of contour at its contact area present in incisal third near the mesio-incisal angle, where the distal outline is convex and more rounded than mesial, and here too the height of contour is at its contact area, which is located at the junction of incisal and middle third. In the incisal aspect, some newly erupted incisors may exhibit mamelons, which are slight round terminations of distolabial, middle labial and mesiolabial lobes, which are nothing but anatomical divisions of tooth, and these three lobes are separated by linear vertical distolabial and mesiolabial developmental depressions. In functionally active incisors, these mamelons are abraded away soon after eruption. If not, even in adults it will be still evident. Without mamelons, the incisal outline is straight and perpendicular to the long axis of tooth. Finally, the cervical margin, also known as cemento-enamel junction, curves evenly toward root. There are few faint curved lines roughly parallel to cemento-enamel junction called as imbrication lines, which are not always present. Labially, the root is of cone shape with blunt apex with straight mesial outline up to middle third and then gradually tapers to the apex. And the distal outline is slightly convex from cervical to middle third and then gradually tapers to the apex. Now, moving to the lingual surface, it looks roughly trapezoidal as labial, but it is narrower mesiodistally because both mesial and distal surfaces converge lingually. There exists a shallow concavity in the incisal half and extends up to 2/3 of the crown called as lingual fossa and ends in a bulky convex structure in cervical portion called as cingulum. Occasionally, there are poorly defined developmental grooves which extend into cervical portion of lingual fossa from cingulum forms W-shaped pattern. Sometimes, but not usually, there exists a linguogingival groove which separates cingulum and lingual fossa, and there may be a lingual pit found in the center of the linguogingival groove. These slightly raised portions are called mesial and distal marginal ridges, extends from their respective incisal angles to cingulum. Along with incisal edge, they form boundary for lingual fossa. Mesial, distal and incisal margins are more or less similar to labial, but the cervical outline has greater depth of curvature than labial, with its area of maximum curvature offset to distal. Root converges lingually, thus the mesial and distal aspects of labial portion can be seen. Let's get into the mesial aspect, where the crown is a roughly triangle in shape with incisal edge at the apex of the triangle, and the surface is convex both incisor-cervically and labiolingually. Here the labial outline is convex with height of contour in the gingival third, and the lingual outline is concave incisally because of lingual fossa and convex gingivally due to presence of cingulum. This entire lingual outline looks somewhat as shallow as here. Height of contour is found in the cervical third. The cervical margin curves evenly towards incisal and exhibits a greatest depth of curvature than any other tooth surface in the mouth. The incisal outline is slightly rounded in newly erupted tooth due to convergence of labial and lingual surfaces, and this termination is called incisal ridge. Once the tooth enters into occlusion, this ridge gets blunt and flat, and the outline becomes straight but slopes from labial to lingual. Now this flat area is called as incisal edge. This is the only proximal area in maxillary arch where mesial surface contact mesial surface. The mesial contact area is located in the incisal third near the incisal margin and centered labiolingually. It is of ovoid shape, longer incisogingivally and narrower labiolingually. The labial outline of root is slightly convex from cervical to middle third and tapers to apex, where the lingual outline is straight from cervical to middle third and tapers to apex gradually. The distal surface is more or less similar to mesial, but there are few significant differences too. Generally, because of shorter incisor-cervical dimension, the distal surface is smaller than mesial, and the cervical margin doesn't curve as far as incisally. While coming to distal contact area, as it contacts lateral incisor, it is smaller in size but still as ovoid and located very near the junction of incisal and middle third. The distal outline of root is similar to mesial. Finally, coming to the incisal aspect, in the central incisor is triangular in outline with straight incisal edge mesiodistally. And also it is evident that lingual surface is narrower mesiodistally than the labial surface. A part of lingual fossa and cingulum are visible, and we can see the greatest contour of cingulum is offset to distal. Thanks for watching. Hope you will like my video. Please share, subscribe and comment.